Hello guys, hope you're all okay. You're all enjoying your life. You're also enjoying watching my video, and you must be enjoying 2024. This is the new year, and you must be having something on your do list and on your agenda and on your objective as well. Today I'm going to talk about a benign tumor which usually involve the child group and teenage, and that is angiofibroma. As I mentioned, it is a benign tumor, but it enormously get enlarged and it sometimes invade the vital organ. The patient will complain of epistaxis. There will be a nasal speech. There may be a obstructive or like airway obstructive changes as well, and some other points which you will notice on the clinical examinations as well. So far the radiology is concerned, the best modality is the conventional radiograph and the CT scan or contrast CT scan. On the conventional radiograph and CT images, what you will appreciate that would be widening of the pterygopalatine fossa, or if in case it gets bigger, it will erode the floor of the sphenoid sinus. It may get entry into the intracranial or the cranial cavity through the superior orbital fissure. It may enter into the orbital cavity through the inferior orbital fissure, and as I mentioned, it's highly vascular tumor, so the moment you give the contrast bullous, it will enhance. So some of the points are quite clear and quite easy to understand, keeping in view the clinical examination and the radiological examination. So how we will appreciate that on the conventional radiograph and then on the CT images. Let's watch these images, and I'm sure you will be able to get all the information regarding the angiofibroma. Here on this image you can appreciate the juvenile angiofibroma, and you can appreciate that it is popping out of the nostril, and it can grow to enormous size. It usually invade the local vital organs, and it is especially seen in the teenagers and almost exclusively in male. On clinical examination, a small sized juvenile angiofibroma will look like the way it is seen in the image, and it will pop out on the lateral wall, or it will be protruding from the medial wall of the nasal or nostril, and you can see in few cases it will grow to an enormous size, and eventually it will come out of the nasal cavity. Another example of juvenile angiofibroma, however, it is a benign nasopharyngeal tumor, but it can grow to an enormous size and it will locally invade the vital structures. As I mentioned, it is exclusively seen in the male, and it is the disease of the teenager, and it may cause nasal speech because of the obstruction of the nasal cavity. So this is the way you can appreciate that the patient has a juvenile angiofibroma, and sometime if it gets bigger it may cause facial deformity. Juvenile angiofibroma is a clinical diagnosis. Here on the nasal speculum you can easily appreciate the juvenile angiofibroma arising from the medial wall or maybe the lateral wall, but it may grow up to an enormous size, and even clinically it will visible that something is popping out of the nasal cavity. The patient will be with a nasal speech, or maybe due to the nasal obstruction, and there may be a facial deformity. As far as the role of the CT scan or MR or single X-ray or plain conventional radiograph is concerned, you have to look for the extension, you have to look for the surrounding invasion, you have to look for the bony destruction. All these points you can appreciate on the conventional radiograph, and you can also appreciate the way it is obstructing the airway. Here on this conventional radiograph lateral aspect, you can appreciate that a large growing juvenile angiofibroma obstructing the airways. It's also widening the pterygopalatine fossa. That happens to be a quite important feature with anterior bowing of the posterior antral wall. Sometime it may invade the sphenoid sinus, and it may erode the floor of the sinus. However, in this case, it is not invading the sphenoid sinus, but widening of the inferior and superior orbital fissure may be able to seen. Another conventional radiograph, you can appreciate that the patient having an angiofibroma obstructing the nasal cavity and especially posterior nasopharyngeal region with a widening of the pterygopalatine fossa. And however, we can't see any invasion of the sphenoid sinus, but it is likely to, if in case it keeps growing, so it is likely that it will invade the sphenoid sinus, or it may erode the floor of the sinus. AP view of the conventional radiograph showing a growing juvenile angiofibroma with widening of the pterygopalatine fossa. However, on the lateral view you can appreciate the pterygopalatine fossa, but as far as the invasion of the sphenoid sinus is concerned, you can still see on the lateral view, but widening of the inferior and superior orbital fissure can be seen on that view, that particular view. It can spread into the orbit via inferior orbital fissure, or sometime into the middle cranial fossa via superior orbital fissure as well. So this is a highly vascular tumor. The best modality is to see on the MR and CT images. Here on this CT images, you can appreciate a well extended and enlarged juvenile angiofibroma with the widening of the pterygopalatine area, with widening of the extension into the maxillary sinuses, and also extending upward, just pushing the floor of the sinuses upward. So this is how it will look if it start growing and it's getting bigger. Here again, an extensive form of juvenile angiofibroma, almost destroying the nasal cavity, the medial nasal septum, and pushing towards the opposite side, and also involving the maxillary sinus, invading the inferior wall of the maxillary sinus. Beside this is also going upward towards the sphenoid sinuses, and there is likely possibility that it may invade the middle cranial fossa. Again, an extensive form of the juvenile angiofibroma. Juvenile angiofibroma is a highly vascular nasopharyngeal mass, which is primarily supplied by the internal maxillary artery, and you can appreciate on the enhanced CT when you give a bolus of injection, so immediately it will start enhancing because of the rich blood supply, and it may extend upward, involve the sphenoid sinuses, or enter into the orbital cavity through the orbital fissure, and it may also involve or invade the middle cranial fossa. So that was all about the juvenile angiofibroma, the most benign nasopharyngeal tumor with the enormous size and with a highly vascular tumors seen in the children or in teenager, and exclusively involving the main. It's likely to reoccur with a severe epistaxis. The main complaint of the patient would be severe epistaxis. You can see that on the conventional radiograph, and then the second modality would be the CT, and the best is to see after enhancing contrast injection, and then you can also have the MR for that to look for any extension into the orbital cavity, into the middle cranial fossa, or into the sphenoid sinuses. So all this was about the juvenile angiofibroma. I do hope this would be a worth watching for you. Keep enjoying, keep sharing my video. Please subscribe my channel, and do not forget to give me the feedback with some other video. We'll see each other. Till then, take great care of yourself.